air quality crisis.
11th most polluted country in Africa.
About 16,000 adults in Ghana died in 2023 because of polluted air.
In parts of Accra, the air isn't just bad. It's 7 times more toxic than what scientists say it's safe for human lungs. Not during a disaster, not next to a chemical spill. This is an ordinary Tuesday morning. At the bus stop, at the market. And the real question isn't if this is a problem. It's why it's still happening. The answer will shock you. In 2023, researchers measured Accra's air at Graphic Road. The results, 267.5. The World Health Organization says anything above 5 is unsafe. Let that sink in. This isn't just a statistic in a report. This is the air inside the lungs of every person stuck in that traffic every single morning. And here's the twist. None of the people creating this pollution are doing anything irrational. They are just trying to survive. This video reveals the hidden system that forces their hand and what it's really costing you. Imagine starting work before sunrise in Accra. You wake early, not for peace, but for more trips, more income. The air feels cool, clean, but that feeling is a lie. By the time you reach Kandishi, your lungs have processed more fine particles than a London commuter breathes in an entire week. That's not careless. You are just doing your job. So why don't people switch to cleaner cooking fuels? Here's the brutal truth. In 2024, charcoal cost 17 cents per kilogram. LPG, $1.20. For families on tight margins, that gap isn't an inconvenience. It's the entire decision. This isn't a knowledge problem. It's a structural one, and it's silently killing thousands. PM 2.5 particles don't stay in your lungs. They are small enough to pass directly into your bloodstream. Your body has no defense. Over time, they raise the risk of stroke, heart disease, respiratory failure. The WHO connects 48% of Ghana's stroke and heart disease deaths to air pollution. Not diet, not smoking, the air. Ghana's non-communicable disease burden is now over 40% of all deaths. Most people making health decisions have no idea the atmosphere is already working against them. But the biggest mistake is believing this is accidental. Because what if the system itself is designed to produce these outcomes? Cooking fuel is one pressure point. Waste is another. And they are terrifying together. Ghana produces over 5 million tons of solid waste every year. Up to 60% of it goes uncollected. When waste has nowhere to go, communities burn it. Not because they enjoy burning trash, but because the collection service doesn't reach them. The alternative is living next to it indefinitely. The fire is rational. The fire is toxic. And the system created the fire by failing to provide an alternative. But here's the lie. Most explanations stop here. They name the sources, describe the harm, and say we need better policies. They miss the most important part. 4 main sources feed the pollution: vehicles, industrial emissions, cooking fuel, and waste burning. But they don't operate in isolation. They form a loop, and this loop has its own brutal logic. Vehicles. Ghana imports second-hand cars because new ones are unaffordable. Older cars produce far more emissions. The city wasn't designed for this volume of traffic, so congestion stays high. Engines idle, the air fills. Waste. Collection infrastructure doesn't cover large parts of the city. No service, no affordable disposal. Burning becomes the only realistic choice. The system pushes waste toward fire. Cooking. LPG and electricity are cleaner but more expensive, less reliable. Charcoal fills the gap because it's available, affordable, consistent. The system pushes households toward biomass. Each loop reinforces the other. And here's the chilling part. Each one makes perfect sense from the inside. Here's what changes when you understand this correctly. The problem isn't that Ghanaians are making bad choices. The problem is that the choices available to most people are the ones that produce bad air. The system wasn't designed with malice. It evolved under real constraints, limited infrastructure, rapid urban growth, and import markets shaped by what people can actually afford. Nobody in this system is broken. The system itself is producing outcomes that nobody individually chooses, but everybody is living with. This is a different kind of problem, and it demands a completely different kind of solution, one that most people are missing. In countries that have meaningfully reduced air pollution, the shift almost always starts the same way. Not a single big policy, not a crackdown, not a campaign. It starts with data. Reliable, specific, publicly available air quality data at the neighborhood level. When communities can see exactly how bad their air is, where it comes from, and when it gets worse, the conversation changes. The problem becomes visible. Accountability becomes possible. Intervention stops being generic and starts being targeted. Right now, Ghana has too few monitoring stations.
For years, some assemblies had no monitoring equipment at all.
We didn't have even one.
What would move the needle are monitors placed where exposure is highest: schools, transport corridors, markets, industrial edges. From there, interventions can match the actual cause. Cleaner buses, affordable clean cooking, real enforcement. None of this is fast. None of it is one decision. It's consistent work over years before the air actually changes. But it can change.
Organizations like Breathe Accra are trying to change that. The project is expanding its air quality monitoring network across Accra. 13 municipal assemblies are each receiving 3 additional sensors.
We started with a number, 267 micrograms per cubic meter on an ordinary morning in Accra. The safe limit is 5. The gap between those two numbers isn't laziness. It isn't ignorance. It's the physical shape of a system built under real constraints, growing faster than its infrastructure, making the only decision available to it. The driver breathing that air at 6 a.m. didn't choose it. The family cooking on charcoal didn't choose it. The community burning waste didn't choose it. But someone has to choose something different now. Not loudly, not in one grand gesture. Consistently over time in the places where it actually matters. Because the air doesn't wait for the perfect policy. It is already inside the body. The question is, who decides what it carries next? If this kind of analysis is useful to you, subscribe. The next video in this series looks at another system producing outcomes nobody chose, but everyone is living with. Don't miss it.